All right, and welcome to Utah Diabetes Prevention and Control presents its diabetes workshop. So here's our program description of our workshop. So Utah Diabetes Prevention and Control's workshop's goal is to teach skills to manage your diabetes and other chronic conditions. In addition to addressing the physical and emotional symptoms of diabetes, this program also aims to help participants better communicate with your healthcare providers and make healthy day-to-day decisions. So the workshop is goal-oriented and it has shown improved health outcomes for people who are looking to better manage their diabetes. Here are some of our program benefits for those who have participated. So participants who have completed this workshop demonstrate increased exercise, increased ability to do social and household activities, less depression, fear, frustration, and worry about their health, reduction in symptoms like pain, increased confidence in their ability to manage their condition, decreased emergency department visits, hospitalizations, increased knowledge for dealing with diabetes-specific symptoms. So we've seen a lot of success throughout our program, and we're excited to help more people with our workshop. So here is what is provided to participants. So our workshops are facilitated by two trained instructors, and they meet once a week for 6 weeks. Each class lasts 1 hour, and during the workshop, the topics covered include pain and fatigue, stress management, monitoring blood sugar, managing hyper and hypoglycemia, how to make an action plan to set and achieve attainable goals, problem solving, how to deal with difficult emotions and complications, physical activity and exercising, healthy eating, communication skills, and working with your healthcare professional, and foot care. So we have a lot of things that we like to work on, and this is what is going to be provided. So today, we're going to do a shorter workshop on grocery shopping. So grocery shopping is an important skill to learn for a healthy lifestyle, and it's kind of the first step to get us started down this path. So using a shopping list can help you stay focused when you're grocery shopping. Healthy eating starts at the grocery store, but successful shopping isn't always as simple as it seems. Your goal is to get the best deals on the healthiest, tastiest food. To use shopping lists to help you stay focused on buying foods that fit your meal plan and budget. And since it can be a little daunting at first, we've included some websites that include some diabetes meal planners. So they have free recipes and a free meal plan for up to 30 days. Here are some tips for your success. The first one is plan a week's worth of meals before you go grocery shopping, and that's what you can use those websites for. Check what you already have on hand so you don't buy what you don't need. Make a shopping list based on your weekly meal plan and organize your list by store section for quick and easy shopping. And you know this one, don't shop hungry so you're not tempted to buy foods that aren't on your shopping list. Shop the outside aisles for fresh food, fruit, vegetables, dairy or dairy alternatives, meat, fish, poultry, and eggs. And then you're going to shop the inside aisles for healthy options such as beans, lentils, flavored vinegars, spices, tuna fish, olive oil, and frozen fruit and vegetables. And make sure those are without sauce, which have a lot of sodium. So beware of food claims like lower in fat and reduced sugar. It still may not be a healthy choice. So you need to make sure you read the nutrition facts labels to understand what the food contains. And we're going to be going over those in just a second. So here is a sample menu, and it has about 1,800 calories of food a day and 200 grams of carbs. And most food labels are based on 2,000 calories a day, and it just depends on your activity level, your age, your gender, and it's something that you can talk with your doctor about. So here's our sample menu. So for breakfast, we've added up all our carbs because carbs are really important. And we don't have a list of the calories because right now we're just going to focus on how many carbs we're getting, because that really has an effect on our blood sugar. So you have a breakfast sample, a lunch sample, a dinner sample, and a snack sample. And you could access this on our page. So here we're going to talk about our important food labels. So understanding the nutrition fact labels on food items can help you make healthier choices. The label breaks down the amount of calories, carbs, fat, fiber, protein, and vitamins per serving of the food, making it easier to compare the nutrition of similar products. Be sure to look at the different brands of the same food because nutrition information can differ a lot. For example, one brand of tomato sauce may have a lot more calories and sugar than another brand for the same serving size. So in general, we try to eat more foods that are higher in vitamins and minerals such as calcium and iron and fiber, and eat fewer foods that are higher in added sugar. And that's when they try to trick you a lot. You have to make sure you really check the sugar labels. And salt, and you need to avoid trans fat. So keep in mind that the percent daily value of each nutrient, such as total fat of 10%, in the example we're going to show you, is based on eating 2,000 calories a day. We talked about this. You may eat fewer or more calories a day depending on your age, gender, activity level, current weight, and whether you're trying to lose or maintain your weight. So it won't always necessarily be 2,000 calories that you eat a day, but that is what is on our food labels. So I've included a practice food label. So we're going to go over this. So this is for a 2,000 calorie diet. So first, you're going to check the serving size here under the number 1, and it's 2/3 cup per serving. And this package has 8 servings. So if you eat the whole thing, you are eating 8 times the amount of calories, carbs, fat, etc. shown on the label. So total carbohydrates shows you the type of carbs in the food, including sugar and fiber. And that's really important for our carb counting. And so we want to choose, like we'll look at number 4, choose foods with more fiber, vitamins, and minerals. So right here we have 4 grams of fiber, which is, it's a decent amount. It's 14% of your daily value of fiber. But then we look and we see that it also has added sugar. So that's 20% of our daily sugar for the day. So choose foods with lower calories, saturated fat, sodium, and added sugars. And once again, avoid trans fats. We're going to talk about our carb counting. Counting carbohydrates or carbs and keeping track of the carbs in all your meals, snacks, and drink can help you match your activity levels and medicines to the foods you eat. Many people with diabetes count carbs to make managing blood sugar easier, which can also help them do the following things: stay healthier longer, feel better, and improve the quality of their life, prevent or delay diabetes complications such as kidney disease, eye disease, heart disease, and stroke. If you take mealtime insulin, you'll count carbs to match your insulin dose to the amount of carbs in your foods and drinks. So that's why looking at our labels is very important. You may also take additional insulin if your blood sugar is higher than your target when eating. Added sugar is hiding in your food. As we saw before, there were a lot of added sugars in that food. So things that can be a little bit sneaky with that added sugar are salad dressings, yogurt, bread, spaghetti sauce. And sugars are added to many foods during processing, and added sugars mean added carbs. So to spot them, check the ingredients list for words ending in "ose," such as fructose or maltose, and any name that includes syrup or juice. Because there's a lot of different names for sugar, so we need to be making sure we're really checking those nutrition labels. So what are the different types of carbs that we're going to be counting? So there are three types of carbs. There's sugar, such as natural sugar in fruit or milk, or added sugar in soda and many other packaged foods. There's starches, including wheat, oats, and other grains, starchy vegetables such as corn, potatoes, and dried beans, lentils, and peas, and fiber, the part of plant food that isn't digested but helps you to stay healthy. Just remember, sugar and starches raise your blood sugar, but fiber does not. Now, how are we measuring these carbs? Because we showed you our sample meal with our carbs already counted out. So carbs are measured in grams. On packaged foods, you can find the total grams on the nutrition fact label. You can also check a list or use a carb counting app on your phone to find grams of carbs in foods and drinks. So for diabetic meal planning, one carb serving is about 15 grams of carb. This isn't always the same as what you think of as a serving of food. For example, people would count a small baked potato as one serving. However, at about 30 grams of carbs, it counts as 2 carb servings. So we have to make sure that we are using our apps and we're looking up how many carbs are in our starches and things like bananas and apples, and it depends, especially with fruits and vegetables, it depends on the size. Now, how many carbs should I eat? There's no one size fits all answer. So everybody is different because everybody's body is different. So the amount you can eat and stay in your target blood sugar range depends on your age, weight, activity level, and other factors. Now, on average, people with diabetes should aim to get about half of their calories from carbs. That means if you're normally eating about 1,800 calories a day to maintain a healthy weight, about 800 to 900 calories can come from carbs. At 4 calories per gram, that's about 200 to 225 carb grams a day. So try to eat about the same amount of carbs at each meal to keep your blood sugar levels steady throughout the day. It's not necessary if you use an insulin pump or you give yourself multiple daily injections. You'll take a fast-acting or short-acting insulin at meal times to match the amount of carbs you already eat. But it's still important to monitor how many carbs you're getting. So how do I find out more about carb counting? Because this can be some really complicated stuff, and all this information might be a little bit overwhelming right now. So you're going to talk with your dietitian about the right amount of carbs for you. And remember, it's not one size fits all when it comes to carbohydrates. So be sure to update your meal plan if your needs change. For example, if you start to exercise more, and it may increase how many carbs you eat, or if you lose weight, that might also change. So ask about tasty, healthy recipes that can help you stay on top of your carb intake, which will make it easier to manage your blood sugar levels too. So I hope that this workshop has been helpful, and I hope it has shown you how important it is to plan ahead for our meals and when we go grocery shopping, and how important it is to look at nutrition levels or nutrition labels so we know how many carbs that we're getting throughout the day. And thanks for joining our workshop today. Can't wait to see you next time.